Okay, so this is my sixth time doing this. Hooray. Anyway, before I get started and I actually walk into my patient's room, I would like to perform hand hygiene and I verify my orders. So when I walk into my patient's room, I'm going to introduce myself, Nurse Morgan, here to do your thorax and lung assessment. And what that is an assessment of your front chest and back chest and listening to your lung sounds, okay? Can I please have your name and date of birth? Get the name and date of birth. First, to start our procedure, gonna have my patient undress themselves to reveal their back so I can see. Keeping the front covered with the back exposed. I'm checking for color uniform. There is no cyanosis or pallor. I'm also checking for hair distribution. There isn't any hair on my patient's back, so that's good. This is a female, by the way. There aren't any present lesions, any past surgical sites, so that is good. And symmetry seems to be aligned. The patient's spine seems to be symmetric as well as the shoulder blades and the back of the shoulders. So that is good also. So after inspecting, I'm just going to count my patient's respiratory rate for 1 full minute. So we have 18 breaths per minute, which is in the normal range. That's good. And the depth and rate and rhythm was normal. So next, I'm going to palpate 10 surfaces on the posterior chest with the pads of my fingertips. While I do this, I'm going to be checking for temperature, texture, um, um, any masses under the skin or any lumps under the skin. So two, 4, 6, 8, 10. So those 10 areas all felt symmetric. There weren't any bumps or masses under the skin. The temperature was warm to touch, not excessively hot or cold. And the texture was smooth. Everything was uniform. Um, Next, I'm going to check for chest expansion. I'm going to place my thumbs at the T10 vertebrae and ask my patient to breathe in and breathe out. And then when they breathe out, my thumb should recoil symmetrically at the same height in a line. And that did happen, so that is good. Next, I'm going to check for costovertebral tenderness. I'm going to place my hand at the costovertebral angle on the right side. And I'm going to ask my patient to verbally indicate whenever they feel tenderness with the light tap of my fist, okay? Any pain? Left costovertebral angle, do the same thing. Any pain? No pain, so that's good. There isn't any tenderness. Next, we're going to auscultate in the lung fields. I'm going to start on the left first. And I'm going to do it with the diaphragm of my stethoscope. Just going to ask my patient to breathe in and out for me every time they feel the stethoscope touch their back. So breathe in and out for me. So upon listening to my patient's posterior chest, there isn't any rhonchi, any wheezing, any crackles, or pleural friction rub, which is good for her. So next, we're going to just turn her around and start to inspect the anterior portion of her chest. So while inspecting, once again, we're going to check for color unity. Let me just say that. There isn't any polar cyanosis within the skin color. There isn't any hair on my patient's chest, which is good. Yeah, no hair on the chest. So I don't have to worry about hair distribution. There aren't any apparent lesions. There aren't any surgical wounds. And I'm also inspecting the symmetry of the anterior chest. So the breasts are aligned and symmetric, as well as the clavicles and the shoulders. So everything is aligned and symmetric up here. Next, I am going to inspect the skin recoil, and I'm just going to pinch the skin at the clavicles. And the skin should recoil or go back to its normal state within 1 to 2 seconds, and it did. So skin recoil is normal, which is good. Next, I am going to just auscultate the post and the anterior portion of the chest. With the diaphragm, and once again, going to ask my patient to breathe in and out whenever they feel the diaphragm of the stethoscope touching their chest. Okay, breathe in and out for me. Okay, other side. In and out. In and out. Good. In and out. In and out. Okay. And checking the long sounds anteriorly. Once again, there aren't any crackles, wheezing, or pleural friction rub, any rhonchi, any of that. So no adventitious long sounds, which is good for my patient. So I'm going to ask my patient if they have any questions. Do you have any questions for me, Miss Jones? Okay. My patient doesn't have any questions, so if we were in the hospital, I would lower the bed, place the bell rails up, make sure the call light is in the bed, and then go document my findings. And yep, go from there.